So for the next heart issue, which we'll be looking at in children, is the atrioventricular septal defect. Atrioventricular septal defect. Now, I want you to always, define terminologies before you look at anything. Atrio is more of like the atria. Ventricular it's more like the atria and the ventricles. Do you understand? Septal is like a fence. Do you understand? A fence where nothing should be passing through. Do you understand? But if you are having issues with the fence between the atria and the ventricles, now anything is passing inside can also go outside. Normally, blood should only flow one way. Okay, you understand? But when blood can flow this way and still flow up, there's an issue with the fence between the atria and the ventricles. Do you understand? So we'll talk about it. All right. So it's also known as atrioventricular canal defect or endocardial cushion defect. It's a congenital heart condition where the walls and valves separating the heart chambers fail to form properly. All right. So there's an abnormal blood flow between the atria, which are the top chambers of the heart, and the ventricles, which are the lower chambers of the heart. Okay. So it causes the heart and the lungs to work harder than normal. All right. So what happens in this atrioventricular septal defect? In a healthy heart, you start with the normal heart. Of course, you are supposed to know the normal thing to know the abnormal. All right. So in a healthy heart, the atrial septum separates the right and the left atria. The ventricular septum separates the right and the left ventricles. Okay. So they always have two valves. So the two valves regulate the blood flow. The blood flow should only be one way, from top to down. Okay. You shouldn't move from what? Down to top again. Okay. So in atrioventricular septal defect, there are holes in the septa. That's the fence between the atria and the ventricles. Okay. Now, instead of two separate valves, there may be a single common atrioventricular valve which may leak or close, may not close properly. So most of the times there's only one valve, not two valves. Okay. So try to tell you that the surgery for this thing too will be really, really crazy. So this allows blood to flow freely between all four chambers. So you don't have a demarcation between oxygenated blood and deoxygenated blood. Everything is just mixing up. All right. So types of this atrioventricular septal defect could be a complete one. This one is a large hole in the center of the heart. The partial one, this one, you have the various separation, but you have holes in there. Do you understand? Then transitional one, you go have features of both complete and partial types. So you could see that a baby having this is so distressed. And you could see that there is like a line in the middle of the chest showing that they actually recently did him a surgery to correct this. Okay. So symptoms in children. Oxygen is not reaching all the tissues, so they are actually becoming bluish. Okay, that's cyanosis. There's rapid breathing and poor feeding, failure to thrive, heart murmurs, fatigue, and frequent respiratory infections. Okay, so diagnosis, I might use echocardiogram, chest x-rays, ECGs, then cardiac MRI or catheterization, just to pick these issues up. So treatments use diuretics and other medications just to manage heart failure issues. Nutritional support so that they can keep growing. Surgical repair, where just like this baby, they did an open heart surgery, to repair it. Okay, so that's it for atrioventricular septal defect in children.